Welcome to the channel, guys. In today's video, we're diving into the essential information you need to know before considering the use of Celebrex, also known as Celecoxib. Whether you're grappling with arthritis, joint pain, or inflammation, this popular prescription medication can offer relief, but it's crucial to be well informed before incorporating it into your healthcare routine. We'll be covering 7 key factors that every potential Celebrex user should be aware of. Stay tuned to ensure you're armed with the knowledge you need to make informed decisions about your health. Let's jump right into the 7 things you should know about using Celebrex. Starting with number 1. Providing a comprehensive medical history is crucial when engaging with healthcare providers to ensure personalized and effective care. Disclosing information about pre-existing conditions is vital, as conditions such as heart disease, high blood pressure, liver or kidney problems, gastrointestinal issues, and asthma can significantly impact treatment plans and medication choices. This knowledge enables healthcare professionals to tailor interventions, minimizing potential risks and optimizing health outcomes. Equally important is the disclosure of any allergies, particularly to non-steroidal anti-inflammatory drugs, NSAIDs, like aspirin or ibuprofen, as this information helps prevent adverse reactions and ensures the selection of safe alternatives. By openly sharing your medical history, you empower your healthcare team to make well-informed decisions, fostering a collaborative approach to your well-being. This transparent communication establishes a foundation for trust and enables healthcare providers to design a care strategy that aligns with your unique health profile, promoting the best possible outcomes. Let's move on to number 2, cardiovascular risk. Understanding the cardiovascular risks associated with medication use is essential for informed decision-making in healthcare. In the case of Celebrex, it's crucial to be aware that the drug may elevate the risk of cardiovascular events such as heart attacks or strokes, particularly when administered at higher doses or overextended periods. Individuals with a history of cardiovascular disease should engage in a detailed discussion with their healthcare provider. This dialogue allows for a thorough assessment of the potential risks and benefits associated with Celebrex use in their specific case. By openly communicating with your doctor about your cardiovascular history and risk factors, you enable them to make informed decisions about the most appropriate course of treatment, potentially considering alternative medications or adjusting dosage to mitigate risks. Number 3 on our list is gastrointestinal risks. Being aware of potential gastrointestinal risks associated with medication use is crucial for maintaining overall health. Celebrex, classified as a non-steroidal anti-inflammatory drug, NSAID, carries a risk of causing gastrointestinal complications such as stomach bleeding or ulcers. Individuals with a history of gastrointestinal issues or those currently taking medications that heighten the risk of stomach problems should engage in an open conversation with their healthcare provider. This discussion enables healthcare professionals to assess the individual's unique health profile and consider alternative treatment options or adjust the dosage to minimize potential gastrointestinal risks. By disclosing relevant medical history and ongoing medications, patients empower their healthcare team to make informed decisions that prioritize safety and well-being. Bringing us to number 4, use during pregnancy. Ensuring the safety of medication use during pregnancy is paramount for the well-being of both the expectant mother and the developing fetus. Pregnant women contemplating the use of Celebrex are strongly advised to consult their healthcare provider before initiating treatment. Celebrex, like other medications, may pose risks to the developing fetus, particularly when used, especially during the 3rd trimester. It is essential for healthcare providers to thoroughly assess the individual circumstances and weigh the potential benefits of Celebrex against the associated risks before recommending its use during pregnancy. This collaborative approach ensures the safety and well-being of both the mother and the unborn child, emphasizing the importance of making informed choices during this critical period of fetal development. Number 5, we have breastfeeding. Breastfeeding mothers should exercise caution when considering the use of Celebrex, as there is a possibility that the medication may pass into breast milk. The safety of Celebrex during breastfeeding has not been firmly established, necessitating a thorough discussion with a healthcare provider to weigh the potential risks and benefits. It is crucial for nursing mothers to communicate openly with their healthcare professionals to make informed decisions regarding the use of Celebrex and ensure the well-being of both the mother and the infant. Consulting a healthcare provider will help in assessing individual circumstances and determining the most suitable course of action to maintain the health and safety of both the breastfeeding mother and her child. Let's move on to number 6, drug interactions. When using Celebrex, it is imperative to communicate openly with your doctor about all the medications, supplements, and herbal products you are currently taking. This information is crucial to prevent potential drug interactions that could compromise your health or the effectiveness of the prescribed treatment. Celebrex, in particular, may interact with specific medications such as blood thinners, ACE inhibitors, and diuretics. These interactions can lead to adverse effects or reduce the intended therapeutic outcomes. Regular communication with your doctor is essential for managing potential drug interactions and optimizing the overall success of your medical regimen. Number 7 on our list is monitoring and regular checkups. Monitoring and regular checkups are crucial aspects of managing your health while taking Celebrex. It is important to regularly monitor your blood pressure, as Celebrex has been associated with the potential to cause an increase in blood pressure. Keeping a close eye on your blood pressure levels allows for the early detection of any changes, enabling prompt intervention if necessary. By actively participating in regular monitoring and checkups, you contribute to the proactive management of your health and facilitate a collaborative approach with your healthcare team in optimizing the benefits of Celebrex while minimizing potential risks. We hope this information has been insightful and helpful in understanding key considerations before starting this medication. If you enjoyed this video and found it helpful, don't forget to give it a thumbs up, subscribe to our channel, and hit that notification bell so you never miss our future content. Remember, this video is not a substitute for professional medical advice, so always consult your healthcare provider before making any decisions about using Celebrex or any other medications. We appreciate your engagement and look forward to bringing you more informative content in the future. Take care.